Uh-oh, guess what day it is? Guess what day it is? Huh? Mike, what day is it, Mike?
Hello, I'm Michael Andrew Weston. And welcome back to part two of my annual with Dr. Luther Walls, our Chief Medical Officer here at Care Alliance. As you know, I've already divulged lots of information, and now he's going to get deeper into my business by doing the physical part of this. And so, Dr. Walls, I guess I'm at your mercy.
Well, Michael, thank you for sharing that information with me. Let's go ahead and start this exam. We'll do it head to toe. I will start off by looking in your ears. Hopefully you cleaned them.
No. You'll tell me if I did or did not. Wax builds up quickly, Dr. Walls.
Well, an important thing to keep in mind is, especially if you're using Q-tips, is that people often tend to push the wax back deeper, which is what she might have done in that ear.
Oh, good for me.
Yeah, he's looking very fierce. All right, can I have you open up your mouth for me? Perfect. This is an especially important part of the exam for us is, again, to remind people to make sure that they're getting their dental screenings, but also if they're smoking and we see any kind of masses or irregularities, that's something for us to notice, especially around their salivary glands, because that's sometimes that can get impacted.
Oh, no.
And I come behind you here, and I'm just going to be pressing down, kind of feeling for your lymph nodes. This can be important for people who have ongoing sicknesses, especially if they're sexually active and they're not using protection. They might have higher risky sexual behaviors. Sometimes multiple lymph nodes, larger lymph nodes can point to underlying conditions. So it's an important part just to make sure we're taking care of you there. Let me have you take a couple of deep breaths. Good. I want to have a deeper breath in through your nose and out through your mouth, please. Great. One more.
I think it's important for me to note too that I've had a spontaneous pneumothorax twice, and so about a third of my left lung has been removed. So I don't know if that's important, but
It's definitely important. If you've had any serious complication or condition that's ever been treated before, it's a great thing to let your provider know, especially the first time meeting them, because that can change our recommendations, that can change the kind of follow-up screenings we may need to do for you. So thank you for sharing that with us. And then one more deep breath, friend. And out. Perfect. Moving on, checking your heart, my friend. You can breathe normally for me. Perfect.
I don't know how I'm supposed to breathe normally when you're doing that. And it puts pressure on me. I'm like,
It didn't speed up this time.
oh, good.
Right, I'm gonna take a listen to your stomach. No, today didn't have any concerns, so I'm expecting it to sound nice and bubbly. It should be a little bit bubbly in here. That's normal bowel sounds.
It's a bubble.
And I'm gonna press on your stomach as well. Any pain that you've been having in your stomach? All right. I'm press lighter at first. You may feel me press a little bit deeper. If you feel anything that's uncomfortable, please let me know. Okay. You can go ahead and sit up for me then.
This is fancy, Dr. Wolf.
Well, we use this one especially for our podiatry patients. And also for our women's health patients, just because it requires a little bit slightly different of an exam table. Something I might do for some of our older patients, or especially our patients with diabetes, is also checking on your foot health. Huge part for our diabetic patients is to make sure that we're at least yearly checking for your sensation in your feet. Unfortunately, sometimes if someone has diabetes, especially if it's uncontrolled, that increases their risk for losing sensation in your hands often, and also in your feet. And it's also especially important as people get older to make sure we're not doing anything that's going to increase their risk for falling. Unfortunately, as you get older, you start falling, you start having fractures, and that really changes your quality of life. So it's about protecting your quality of life and really being preventive rather than reactive. That's the goal. Really, I'm doing the annual visit.
Well, I heard you said that, you primarily, especially, not primarily, but especially with older adults. But, I mean, diabetes can affect anybody.
Absolutely.
And so, that's one of the things that I have tried to be aware of, because I know that familial history says that diabetes is possible. Just monitoring not just my diet, but when I'm at the doctor, wanting to make sure that those things are taken care of as well, are looked after. So that's a good point.
Yeah, and I really appreciate you bringing that up because again, when we're talking about how can we take the best care of you, we have to consider what's going on with you, but also what's happened in your family. But it's really important as part of your annual visit. Hey, if we haven't checked to see if you have diabetes and we know that your mom has diabetes, your dad has diabetes, we should check it at least once a year. But it's really, really important to share and to ask questions. And I know that I ask, if you asking my patients, I ask lots of questions, but it's because I need to know what's going on to take the best care.
No, I mean, and I trust you with this information. Not Neil, no kidding. But no, I trust you with this information. We're going to continue my appointment. We're going to finish it up. But I thank you all so much for joining us, Dr. Ross. Thank you for allowing us in the exam room so that we can do this. And we will see you next time for Hump Day Health Talk.